So in the last session that Dr. Michael Exet talked to you about what atrial fibrillation means to your health. And in this session that we're going to talk about the management strategy of atrial fibrillation, especially from the medication point of view. When we talk about atrial fibrillation management, there are three main areas that we try to cover. Number one, to cover the stroke risk. Number two, to prevent heart failure. And the third is basically managing symptoms. If you talk about out of all these three, stroke prevention is the core of atrial fibrillation management because that once we look after the stroke risk, the other are relatively minor to manage. What that means is that we will give you medication to thin the blood and to prevent stroke. At the moment that when you talk about stroke risk, it varies from patient, but we do have a good system to risk stratify patient. In short, they are called a CHADVASC score, CHADVASC. It basically makes make of a different component of a patient, other health risks such as diabetes, hypertension, heart failure. So based on this scoring system, that we will decide whether to start a patient on a blood thinner. Blood thinner consists of two major groups of medication. The old-fashioned warfarin or Maravan, which a lot of patients will be familiar. The other newer group of blood thinner are called novel anticoagulation. In general, we have three in Australia. The common names that you might heard of are like Pradaxa, rivaroxaban, and apixaban. Second and third things that we like to prevent is heart failure and symptoms management. In this category, we have two broad different strategy, which is rate control, meaning that we simply accept atrial fibrillation by using medication to slow down the heart rate, or rhythm control, which means that we do all we can by keeping a patient in normal rhythm. So if we talk about prevention of heart failure, we can use either one of this strategy. The difficulty some patient might face with atrial fibrillation and heart failure is that when the heart rate running fast, it's like they're doing marathon 24/7, so it will eventually wear out the heart muscles over months or years. Simply putting a patient on a medication to slow down the heart rate will prevent them from having heart failure. And if we manage to keep the heart in a normal rhythm, that means that the heart failure risk is well managed. And last thing about symptoms, there are patients who will continue to have symptoms such as palpitation, shortness of breath, fainting spells or near fainting spells, or even night sweats. And what we know is that there are patients who suffer these symptoms even though the heart rate is well controlled when they're in atrial fibrillation. So in this group of patients, it is better that we adopt a rhythm control strategy rather than rate control. In rhythm control strategy, by using medication, we have three major medication available in Australia. So they are sotalol, flecainide, and amiodarone. And each one of these has different efficacy and side effects profile. And as always, that the more efficacious the medication, you will expect more side effects. In some patients, they're not having too many episodes of atrial fibrillation. For example, once or twice per year. Now, it makes no sense at all if I were to ask this particular patient to take a medication for 365 days just to prevent 1 or 2 episodes per year. In those circumstances, we have a slightly different strategy, which is called pill in the pocket. What that means is that patient only needs to take the medication if they have atrial fibrillation. The medication in general consists of a flecainide and a rate control medication such as a beta blocker or calcium channel blocker or even a digoxin sometime. And the patient basically just take this if they have symptoms of atrial fibrillation, and the medication will basically help them to revert back to normal rhythm quicker. Now, this strategy is useful if someone has infrequent episode of atrial fibrillation. If they have, let's say, a lot of episodes per year, it will be best that they take medication regularly. It is important to speak to your doctor if you experience any side effects, because everyone reacts differently to medication, and there are other options available. In the next session, Dr. Robert Perel will talk to you about lifestyle modification that might be helpful in atrial fibrillation management.